The recent controversy over paracetamol use during pregnancy and its alleged connections to autism and ADHD has gained significant attention, particularly after prominent political figures in the United States, including President Donald Trump and Health Secretary Robert F. Kennedy Jr., made definitive claims about this link. However, the scientific evidence presents a much more complex picture that requires careful examination. Over the past decade, researchers have conducted numerous observational studies exploring potential connections between prenatal paracetamol exposure and neurodevelopmental conditions. While some studies identified associations between paracetamol use during pregnancy and slightly higher rates of autism or ADHD diagnoses in children, these findings come with important caveats. The fundamental principle that correlation doesn't equal causation becomes particularly relevant in this context, as many other factors could explain these associations. A landmark Swedish study published in 2024 provided compelling evidence that challenges these claimed connections. This comprehensive research examined more than 2.5 million children using an innovative sibling comparison design. By comparing brothers and sisters where one was exposed to paracetamol in the womb while the other wasn't, researchers could control for family and genetic factors more effectively. Their findings showed no increased risk of neurodevelopmental disorders associated with prenatal paracetamol exposure when these factors were properly controlled. Australian health authorities have responded decisively to the international debate. The Therapeutic Goods Administration and Chief Medical Officer Professor Michael Kidd have explicitly stated that there is no strong evidence supporting a causal link between paracetamol use during pregnancy and neurodevelopmental disorders. In Australia, paracetamol maintains its Category A drug classification, indicating its recognised safety profile for use during pregnancy when taken as directed. The Royal Australian and New Zealand College of Obstetricians and Gynecologists has emphasised a crucial point often overlooked in this debate. Paracetamol frequently represents the only safe option for managing pain or fever during pregnancy. The risks of avoiding necessary paracetamol use could potentially outweigh any theoretical risks, as conditions like high fever during pregnancy can lead to serious complications for both mother and developing baby. The scientific challenges in studying medication safety during pregnancy are substantial and worth understanding. Ethical considerations prevent researchers from conducting randomized controlled trials, the gold standard of medical research, forcing reliance on observational studies. These studies often struggle to fully account for confounding factors such as the mother's underlying health conditions, pain levels, fever, or genetic predispositions. Laboratory studies have suggested possible biological mechanisms, including oxidative stress and epigenetic changes, that could theoretically link paracetamol exposure to neurodevelopmental effects. However, these findings from lab studies haven't been confirmed in human populations, highlighting the gap between theoretical risks and proven effects. The scale of this issue cannot be understated. Paracetamol ranks among the most commonly used medications worldwide, including during pregnancy. While this means that even a small risk, if proven, could have significant public health implications, it equally means that creating unnecessary panic could negatively impact millions of families and potentially lead to harmful treatment avoidance. Current Australian guidance maintains that paracetamol remains the safest first-line option for managing pain and fever during pregnancy. Health authorities recommend using it at the lowest effective dose for the shortest necessary duration, always in consultation with healthcare providers. This balanced approach acknowledges both the medication's important role in managing pregnancy-related conditions and the need for responsible use. The controversy serves as a powerful reminder of how complex scientific findings can be oversimplified in public discourse, potentially leading to unnecessary fear and anxiety among expectant parents. It highlights the critical importance of careful health communication and the need to distinguish between political statements and evidence-based medical advice. As research continues, the focus remains on generating high-quality evidence that can better understand any potential risks, while ensuring pregnant women have access to safe and effective pain management options.